Now, good evening and welcome to Uliza Daktari. Now, last week we missed you because we were deep in mourning the loss of the former Prime Minister, Right Honorable Raila Odinga. Now, from Uliza Daktari and the medical fraternity, we offer our deepest condolences to Mama Ida and the family for that deep loss, and we continue praying for God to rest his soul in eternal peace. Now, early this month of October, we had a gathering of over 5,000 obstetricians and gynecologists in Cape Town. Now, mkutano huu ulikuwa wa kujadili mambo kuhusu afya ya kina mama, and one of the biggest topics of discussion was postpartum hemorrhage. Now, why, you ask? This is because postpartum hemorrhage is one of the leading causes of maternal deaths in Kenya and worldwide. So we lose about 355 mothers in every 100,000 live births. So you can imagine that this is the leading cause of over 40% of the deaths that we have in mothers in Kenya. Now, just to put this into perspective, we are saying that every day, on average, we are losing about 16 mothers to bleeding heavily after delivery. Yani hii inamaanisha, ukiangalia ile matatu ambayo inabeba watu around 14, this means that every day, this would be equated to that kind of matatu crashing and losing all the occupants of that matatu. So this is an emotive topic and one that has affected many families worldwide. Now, to take us through this discussion, we have a special guest who is also my teacher and former lecturer at the University of Nairobi. So Dr. Francis Odawa is a practicing obstetrician and gynecologist and one who is passionate about women's health. Karibu sana, Dr. Odawa.
Thank you, Dr.
You're very welcome to the show. We are honored to have you.
Asante.
Okay. Now, PPH is a topic that is not just important, but it's also very personal to me. So I experienced this not just from the provider's side, but as someone who has experienced PPH on a personal level during one of my deliveries. So PPH is something that can affect anyone. Sio daktari, sio mwalimu, kila mtu. And to share her story with us is our midwife, Eunice, who tells us just how she encountered this.
I'm a mother of 2. So the first pregnancy was quite uneventful, although we ended up having cesarean section because of other reasons. The second pregnancy was quite uneventful, although it came quite soon after the first pregnancy. But the pregnancy was very peaceful. I did everything a woman is supposed to do, and given my profession, I knew also what to do in terms of making sure I'm healthy. So I attended all the clinics. I was able to consult where possible, and eventually we made a birth plan with my obstetrician at the time. So the obstetrician suggested that we do a cesarean section because the pregnancy had come so soon after the first one. So given it was a planned cesarean section, I was admitted in one of the major national hospitals. And they prepared me pretty well the previous night before cesarean section. And at 5:30 in the morning, I was wheeled to theater. So like any other cesarean section, I think mine went just the same way. The moment I woke up, I felt like I was in a lot of fluid, which was warm. So presumably, given my career, I thought that would have been blood. So I called the recovery nurse who was there and told her, I think I'm bleeding. So when she opened the bed linen, she noted I was bleeding a lot. And when it flowed down, I could actually see that it's not clotting. I suspected this could be disseminated intravascular coagulation. The nurse was there actually said, you know, I've been seeing your blood pressure go down. And I thought maybe I just needed to add fluid. So she kept on increasing the amount of IV fluid, but then didn't check didn't check on the client in terms of checking whether I'm bleeding or not. So she actually acted very quickly by calling the doctors who were around in other theaters. So the doctor was there, looked at me and examined and said, oh, the uterus is not well contracted, and started initiating the postpartum hemorrhage measures. So all along, I was so scared to the extent I felt like there was doom, you know, impending doom. And because of that, I started asking that I wanted to see my child, because I felt like I'm just going to die without seeing my baby. Of course, I was also scared that the uterus would go, because when the doctor was like, oh, the uterus is not also contracting effectively. But then in this time, I was like, even if the uterus goes, it's okay, as long as I'm alive to take care of my child. I think I was a very lucky Kenyan, because I was in a hospital where blood was availed within minutes. You know, when they just said we need blood, because cross-matching had been done for 3 units. And now in this case, they needed 6 units of blood, and they needed fresh frozen plasma, another, I think, about 8 units. All those products were availed within the shortest time possible. After after all the events within theatre, I stayed in theatre from around 5:30 that I was wheeled in up to around 12:30. Remember, it was a procedure that was to take like half an hour. But now, up to 12:30, that's when now I was being taken to the ward. At around 4:30, I was even able to walk, to leave the bed and, go to the washroom and all that. After 2 weeks, I think the recovery went on okay. I was quite intentional in terms of feeding. I was also intentional in terms of observing that there is nothing, nothing going wrong. And in case maybe I saw even, like when I saw the wound starting to look like there is a little bit of infection, I went aggressive on it by taking the strongest antibiotics available. It left a trauma in such a way that I'm scared of having another child. I was scared. Of course, right now, maybe age will not allow. But then at that time, I was so scared because my child is now 16 years. And but I became very scared to have another baby. Even my husband is traumatized to date.
Now, I can definitely relate to the story. Can you? Have you, your partner, or someone you know experienced postpartum hemorrhage? Talk to us on our SMS line on 22422. Engage us on our socials at Uliza Daktari and at Daktari_Mengesa. And please reach out with your questions, comments, and thoughts on this topic. Now, one of the things we did in South Africa was to declare 5th October as the World PPH Day. And this is about creating awareness. Yani kuwajulisha ni nini haswa tunazungumzia tukisema PPH. Na najua mojawapo ya ile swali mnauliza ni tukisema PPH tunamaanisha nini? Na hii damu inatoka wapi haswa, daktari?
Thank you, Dr. Mengesa. The subject of tonight is a subject that is very dear to my heart. It is dear to my heart to the extent that it is usually a matter of life or death. And what you do makes the difference. But before I embark on this subject, just to pick a cue from you, I think I would like to take this opportunity to condole with the Odinga family, Ida and the children, the rest of the grieving nation, the bigger Jaramogi family, and the international community, following on the demise of Raila Amolo Odinga, our former Prime Minister. He was a magnanimous man. He was a warm, amiable human being. The most forgiving human being I've ever known. He forgave his political tormentors, including their political orphans, and rehabilitated them. May God the Almighty rest his soul in eternal peace.
Amen.
As we embark on this journey to save our women from this scourge that we know is the leading cause of maternal death in terms of childbearing. Thank you. You asked me, what is postpartum hemorrhage? And where does it come from? Postpartum hemorrhage is defined as loss of about half a liter. Did I see half a liter here?
Yes, it's right here, sir.
Half a liter, 500 mils of blood from the woman's genital tract following on a childbirth normal childbirth, normal delivery, and twice this, that is 1 liter, if it is through cesarean delivery. Where does this loss come from? What you see here depicts the female genital tract, starting from the entry point, which is the vagina. Kindly bring it back. That is the vaginal opening. This is the vaginal canal. This is the cervix, which is the entry point from the vagina into the uterus. The uterus is the organ that carries the babies. It is the organ that menstruates every month, following on stimulation from these other organs here, the ovaries, which produce hormones. A baby is carried here for the entire gestational period, for as long as the pregnancy exists. Normally supposed to be 40 weeks, which we refer to as 9 months. But sometimes that may happen earlier. When that time comes, that baby has to come out. It could come out naturally, as is expected, created by God, when the uterus goes into activity to expel that conceptus, or that baby. Sometimes, if that is not tenable, we do what we call a cesarean section. We cut through the uterus to deliver the baby. Following on a normal birth, many things can happen. You can get tears in the vagina, right from the vulva down here, on the vaginal wall. You can get tears on the cervix, and that can lead to bleeding. Where the placenta is usually attached, once that placenta is delivered, can also cause bleeding because it leaves vessels and a bare area through which blood can be lost. This entire organ sometimes can burst or rupture if circumstances are that difficult, like obstructed labor, or if there was a previous scar on that uterus. And all those can lead to severe hemorrhage. If you lose 500 mils on a normal birth, we consider that postpartum hemorrhage. If you lose more than 1 liter or about, during cesarean, that is also postpartum hemorrhage.
Na daktari, so umeongelea mambo ya tears ambazo zinaweza tokea anywhere on the genital tract. Kuna mambo mengine mama anaweza kuwa nayo kabla ya kujifungua ambayo inaweza fanya kuwe na higher risk ya damu hii kuvuja kwa wingi?
Rightfully put. The more reason why we are here. The more reason why as health workers we should be on the lookout. The more reason why our system should be ready to tackle this kind of thing. Because if we are not ready, we lose life. If a mother goes to the clinic, antenatal clinic, the health providers are able to establish or predict those that may be at higher risk of what we are talking about. For instance, a big baby. For instance, a mother who has had a cesarean section before. For instance, if the placenta is lowly attached, we call that placenta previa, which is known to cause hemorrhage even before birth, actually. Antepartum hemorrhage, hemorrhage before birth. If the placenta is burrowed onto the uterine wall deeply, that makes the condition worse. If you try to separate it, it's a Pandora's box. You may cause a lot of bleeding. So these things can be predicted. Through ultrasound scanning, you can tell where the placenta is attached. You can tell whether the placenta has deeply burrowed onto the uterine wall. You can also estimate the fetal size vis-a-vis the maternal size, which will tell you whether that childbirth will be easy normally or may require intervention before exposing the woman to the dangers.
Thank you so much, Dr. Odawa. Now, umeambiwa ni nini haswa yaweza kukufanya uwe na higher risk ya kupata shida ya kuvuja damu kwa wingi baada ya kujifungua? Talk to us about your experience on our SMS lines below and engage us on our socials. Now, after the break, we're going to be looking at how do you identify someone who's bleeding too much and what do we do? See you soon. saying, hello, Uliza Daktari. I'm a mom of 2 kids, 2 years, and I experienced PPH when my son was 1 month old. She bled for 4 weeks from birth. So anasema she experienced dizziness and issues with consciousness, and she was feeling a full pad in less than an hour. There was blood clots na damu ilikuwa inatoka kama mfereji. I was feeling not like a normal period which comes out slowly. Anasema alhamdulillah, I went to the hospital and was injected with a medicine to stop the bleeding. Then she did a scan and she was given folate, and she now says she turned out she was pregnant again 2 months later, but now the baby is fine at 2 years. Now, kuna mwingine anasema, hi Dorcas, her name is Dorcas, she's 29 years old from Makueni. Anasema she got her baby in June, but the process of delivering, she got a cervical tear, kama ile ulituonesha pale kwa picha. I ended up being taken to theater after delivery for more examinations and kushonwa pia. So my question is it possible to carry a full-term pregnancy in the future? Haya, mwingine swali la mwisho anasema, in my case Daktari, I was advised in case of a second pregnancy, I opt for CS because what led to the first PPH was a cervical tear during normal childbirth. So I think kabla tuingie kwa hayo maswali, ningependa kuuliza daktari, kama mgonjwa, sasa ni wewe uko pale umejifungua. Ni baada ya kujifungua, pengine uko pale kitandani, ni dalili zipi ambazo ukiona inabidi uitane usaidizi kwa haraka kama mgonjwa? Na tena sisi kama madaktari ama wale wauguzi ambao wanaangalia huyu mgonjwa, ni nini haswa tunaangalia ili tujue huyu mama anatoa ama anavuja damu zaidi kuliko ile kiwango tunatarajia kwa kawaida?
Good question. The more reason why every pregnant woman should strive to deliver under the care of a qualified medical personnel.
No.
And that therefore means that they have to come to the health facilities that have the personnel that can take care of them, and the interventions that may be performed when such a thing happens. I know many women deliver at home, which is pretty risky. You asking what is it you would like to look out for. If you are doing this in your home without any assistance, that becomes very difficult. That becomes very difficult. Of course, when you are in a health facility, you have delivered and probably you are settled somewhere in a room, you need to keep checking your pad and see whether you are bleeding excessively or not. You can tell the difference between would-be normal bleeding and excessive bleeding, and I've defined it. Bleeding that translates to about 500 mils or half a liter is, after a normal birth, is considered postpartum hemorrhage. Bleeding that is more than a liter during cesarean, and that time the health personnel will be there to witness it, to observe it, and to be able to document what they are seeing. That is considered postpartum hemorrhage. So yes, indeed, watch out for it if you have delivered normally or even after cesarean and you are kept somewhere for observation and there is nobody around. The other thing you may experience is you may feel giddy.
Alafu turudi kwako. Sawa, tunasimu kutoka Fatma. Hello.
Hello, daktari, habari yako?
Mzuri, habari ya Thika?
Mzuri sana.
Swali lako?
Mimi nime experience ya PPH na watoto wangu wawili. Mara ya kwanza nilipata excessive bleeding, alafu pressure huwa inapanda. Na huyu wa pili pia the same, alafu pia pressure ilipanda. Alafu ninapata hiyo excessive bleeding, inabidi narudishwa maternity for almost 3 to 4 hours. Sasa nilikuwa nauliza daktari, is it advisable nipate mtoto mwingine ama tu nitosheke na hawa, kwa sababu every time nikisikia about conception huwa nasikia uoga.
Ulijifungua kwa njia gani, ya kawaida ama operation ya CS?
Njia ya kawaida daktari.
Okay, asante kwa swali lako. So wasiwasi ko pale. Anasema alipata PPH mtoto wa kwanza, wa pili. And the interesting thing about obstetrics is when something happens mara ya kwanza,
it can happen again.
Mara mingi tena inafanyika kwa mara ya pili. So anasema je, ataweza pata mtoto mwingine ama akome pale?
That is a good case study. Kitu ni kuwa imefanyika na imefanyika tena. Hiyo yamaanisha tena inaweza fanyika tena. So the best thing to do is make sure when you get pregnant again, you get to a health facility where you can be assisted. The commonest cause of postpartum hemorrhage, as we know it, following on a normal birth, and sometimes even after cesarean, is if the uterus refuses to contract. It is called uterine atony. And there are ways to go about that. If you are under care of qualified personnel, there are ways to do it. They can simply hold on to that uterus and massage it and force it to contract, and it does happen. There are medicines we use called uterotonics that make that uterus contract and prevent hemorrhage. If it is things like placenta previa that I mentioned, the health provider will be able to identify that and take special caution that knowing that where that placenta is makes it not possible for the uterus to contract properly, then they will consciously be able to make that uterus contract by either just massaging it or by giving you the uterotonics that I've talked about. So please, ukiwa mjamzito tena, sisemi usipate mimba tena. No, sio hivyo. Bora tu uwe ukijua you are at risk of bleeding after your birth. So make sure uwe kwa health facility ambapo utaweza pata usaidizi.
Turejele ile swali ya kwanza, aliongelea mambo ya cervical tear. Na pia yule alikuwa na wasiwasi. Alikuwa anasema sasa kama ulishonwa ile cervix juu ya PPH kwa delivery moja, ile inafuatia. Inamaanisha utajifungua na CS?
Sio lazima though, sio lazima. Kunazo wakati ambayo pengine hiyo tear ilikuwa karibu na vessel, blood vessel. Ndio sababu uka bleed namna hiyo ama ukafuja damu namna hiyo. Lakini ukiwa kwa health facility ambapo utasaidiwa kujifungua, itaweza onekana kama kitu kama hiyo imetendeka, kwa sababu huwa tunaangalia hiyo cervix tujue iko sawa ama imepasuka. Na utapata usaidizi, sio lazima. Na wakati mwingi ukishazaa normally, hiyo cervix huwa inapanuka. Kwa hivyo the next one itakuwa rahisi kidogo. Pengine sio lazima itapasuka tena.
Naam. Haya, kuna swali panasema, why not have blood ready during childbirth? That's during antenatal visit and the mother's blood group should be already established just in any case the bleeding occurs. So hii inaturejelea kwa mambo yetu ya ANC. Yani ile njia tunatembea na mgonjwa kutoka wakati anaanza kuja akiwa na mimba. Ni mambo gani ambayo tunafanya during this ANC ili kutayarisha huyu mama ili kureduce hiyo risk ya kuvuja damu kwa njia hiyo?
One of the preventive measures to this scourge of postpartum hemorrhage and any other thing that may arise during childbirth is mothers going for antenatal care. Ili wahudumu wa afya waweze kukukagua, wajue kama uko kwa risk. If you are at risk, and there are things that you look for. I mentioned it a while ago. One, what is the size of your baby? What is your own size? Is it possible that that baby will pass easily? Or can it cause problems that may cause rupture? That is one. Two, we have talked about scanning. Where is this placenta? Is it at a risky position? So that we take caution. Three, have you had this kind of problem, like what we have just said a while ago? So that we take special caution. And what are some of the preparedness that we put in place?
Daktari, kama hujaingia pale, tuna simu kutoka Kisumu, tutaichukua alafu tuendelee. Hello, Faustin.
Hello, Daktari. How are you?
Fine, thank you. Karibu Uliza Daktari.
Thank you so much. My name is Faustin from Kisumu, and I have had postpartum 2 times, hemorrhage. The first one was 9 years ago, and I had due to precipitate labor. I was explained that way at Kenyatta National Hospital. Then this year also, I gave birth to a baby 4.1 kg, normal, and I also had very bad postpartum hemorrhage. I lost 2.1 liters of blood.
Wow.
And then after that, I kept on losing until my HB was 5.
Wow.
I had to be done from 14 because I was eating so well. I remember my HB was 14 when I was doing the ANC visit. and then I lost so much. Then my husband doesn't kind of understand. He wants us to give birth faster and finish. I tried to explain to him I almost lost my life, and it is. I think men should also be sensitized about these things because they do not understand. Then I remember the nurse who was on shift told me that I should try CS next time. So I wanted to ask Daktari, how long should someone take to conceive after a PPH, and does having CS as an option will prevent the same occurrence? Thank you so much.
Asante kwa swali lako. Congratulations on your new baby, and we are glad that you managed to navigate and survive that very, very harrowing experience. Jamani wanaume, tunasema leo tunazungumza na nyinyi, lakini kwanza we'll take a short break. Don't touch that dial. Stay tuned. And welcome back. Now, before the break, we listened to Faustin from Kisumu. Faustin alikuwa anasema kwamba alipata mtoto kilo 4.1 kwa njia ya kawaida, na alikuwa na wasiwasi kwa sababu anasema mzee anasema jamani anataka mtoto mwingine sasa hivi. So her concerns were, should she now give birth via CS? Will it be safer? Pale alitueleza alipata bleeding hadi HB kasrudi chini hadi 5. So maybe just talk to us about what are some of the things ambazo tunafanya antenatally alafu tena baada ya kujifungua ili kutatua shida hii. And is CS really the option for someone who has bled after PPH in a normal delivery?
Like we said earlier, mothers need to come for antenatal care during pregnancy. There are certain important things we do which help us predict if there could be a problem and also make preparation to forestall them just in case it occurred. There is something we call antenatal profiling. I'll not go into the details of what the others are, but the two most important things we do is to check your blood group and your blood level. Because if anything is happening and we know your blood group and we have blood to replace, it is easier for us to do that very quickly. 2, your blood level. In case you are anemic, your blood level is low, we will give you blood builders so that we optimize it and that you are at a lesser risk, even after some loss, to get into real great trouble, just in case you've lost blood. So those are important things we do. So coming to the clinic for antenatal care is the first thing. The second one, as health providers, and I would hasten to say this here, that as nations and as countries, we need to consciously invest in the health of women, particularly women in the reproductive age. Maternal mortality ratio, that is the amount of deaths that we experience in our setup, particularly in this part of the world, including our own country, is actually unacceptable. It is unacceptable to the extent that countries that were at the same level of development during independence, like the giant tigers, the Asian giant tigers, I'm talking about Hong Kong, South Korea, Singapore, and Taiwan, now register maternal mortality ratio of as low as 10 and below, whereas we are still at 149. What is it they did? They consciously invested in the life of women and their reproductive health. What is it they do? They ensure that they have facilities closer to the people so that in the event that you go into labor, you can reach the facility quickly enough. And you have qualified providers to take care of you antenatally and also during childbirth. We are able to have equipped facilities closer to the people. In the event that there is a complication, you can easily get cesarean section or other intervention. We have blood banks available to keep blood for such emergencies when you have lost blood. We have other medications that help us control bleeding during childbirth. We call them uterotonics. And some of them are basic. They are basic. They can be utilized by anybody to help life in the event that this is happening. So we must consciously invest in the health of our women as nations.
Okay. Na mtu swali hapa anasema good evening Daktari, I'm Chep from Eldoret. I got my firstborn through CS. It was a big baby. Anasema 4.2 kilos na alikuwa na placenta previa, bleeding during the pregnancy. Lakini anasema thanks to Daktari from Kisumu, Dr. Akula, my secondborn was normal. She was not induced. So the question is, she'd like to have a thirdborn and she's in fear of that. Hello, I gave birth and had postpartum hemorrhage. I had a cervical tear. I was taken to theater 3 times for stitching, but they didn't know that part of the placenta had remained and they had asked me to go through CS instead of a normal delivery. Kuna swali pale inasema, I had a retained placenta after normal birth and it causes PPH. What might have caused it? Na swali nyingine anasema, hi Daktari, I have experienced PPH twice, both from normal delivery in 2020 and 2023. Na anasema 2023 she passed out after delivery and woke up 4 hours later in theater having lost 3.5 pints of blood. Remember, una pengine kama 5 liters za damu. It's God's grace that I am alive today. Now, the 500 ml Daktari ameongelea ni a single pad or per day. Naam, so Daktari, maswali hapa yanarejelea kuhusu kama umekuwa na PPH, what happens next? Na kuna hii jambo wamerejelea ya retained placenta kama one of the causes. What normally happens na hii retained placenta and how do we manage it? Na kuongelea pale bado tunaingilia ni mambo gani ambayo tunafanya pale hospitalini ili kudeal na mgonjwa akipata hii PPH.
We are still talking around the most common causes of postpartum hemorrhage, which are 3-4 T's. The first being the tone, uterine contraction. The second being the tissue. This tissue is actually the placenta, which ought to be delivered as soon as the baby has been born.
Yeah.
It shouldn't take more than an hour. In fact, an hour is too long. And 3 tears that we have mentioned. There is yet another T. So what then happens? When the baby has been delivered, there should be a conscious effort to deliver the placenta. And there is a way we do it. We call it controlled cord traction. You do it, pull gently as you massage and support the uterus until that placenta comes out. If it doesn't come out, then obviously it is retained. And then you consciously must go in and remove it. That can be done in theater. Sometimes you remove the placenta and you notice that it is actually not complete. Part of it has come out, the other part has been retained. And that is what we call the retained tissue or retained placenta. That will inevitably cause continued bleeding. So as a health provider, you have to consciously try and get it out. Initially, you can try that manually in the delivery room, or if that doesn't work, you would have to take that patient to theater to manually expel that placenta.
Now, Daktari, first alizungumzia the pressure she's getting from her husband to have another child. Kama mwanaume, unaweza ambia nini wanaume wenzako kuhusu PPH, kuhusu mambo ya ile spacing? Kwa sababu alikuwa na wasiwasi, how much time should she take kabla ya kupata mtoto mwingine? What is your advice?
Leave alone pressure to have another baby. Gentlemen, we need to accompany our women.
Thank you.
When they are going to the clinics for antenatal care. Because by doing that, you will be able to be on board to know what are some of the problems that may arise. With that conscience, then you will know that when anything is happening, like your wife goes into labor, she ought to be rushed to hospital. If you leave her alone, that is a great risk, because sometimes she may not have the means. If she's not prepared or accompanied. That is 1. 2, we know the good spacing, the best spacing time for children. When we were born in those olden days, some of us came a year or 2 years apart. And we know that puts a lot of strain on this mama in terms of recovering from the previous delivery, including the anemia that may ensue because of blood loss, in terms of the recovery of that uterus, etc., etc. So ideally we recommend, and it's not just for the mother, even for the baby, that child needs to be given space to develop and mature. You bring another one too soon, they'll feel deprived, psychologically, nutritionally, etc. So there should be sufficient spacing. And that spacing, as we recommend, normally should be 3 years. That is the best spacing. Men should not put pressure on their wives to get babies in less than 3 years.
Okay. Now, the last question you're going to answer, amesema ile 500 ml. Anauliza, is it in a day? Ama ni what period are we looking at kusema 500 ml? So unaweza tujibu hiyo swali and then give us your parting shot as we close.
Usually it is soon after birth, but maximum 24 hours. Range 12 to 24 hours. I had one ask about the pad. We know that each pad will accommodate about 50 meals. So if you use 10 pads in that space of time, you'll already have lost 500 meals. And you can tell this is a bit on the higher side. Right.
Thank you so much, Dr. Odam.
My parting words, just like I've said.
In 30 seconds.
I'm gratified that our head of state is talking about us becoming a first world in our lifetime. Indeed, I think this is achievable. The Right Reverend Raila Amolo Odinga always made comparisons to the giant tigers, and I think he might have passed on a disappointed man that we didn't get there when those countries were at the same level of development as we were during our independence. Consciously, again, I would want to put it straight that as a nation, let us strive to develop, fight the three main issues that confronted us at independence: poverty, disease, and ignorance, because the three are intertwined. If we can work around those, these issues we are talking about may be a thing of the past.
Thank you.
I have talked about the giant tigers being at 10, women lost after 100,000. The best place we know is Sweden with 5 of that. We are still at 149.
Asante.
We are able to achieve that.
Thank you, thank you. Postpartum hemorrhage is indeed a preventable cause of death, and it starts with you, your partner, and all of us as a nation. So please, let's look out for this bleeding. Let's prepare, attend your ANC. Now, for all those who are sitting the national exam starting tomorrow, best of wishes from myself and Uliza Daktari and the citizen family in general. See you next week at 8 p.m. Sunday on Uliza Daktari.